you can't be afraid. We have to be bold and courageous. Just like you fight for any sort of freedom, we have to fight for our healthcare freedom. And we need to remember that every day of our life.
Keeping our republic is on the line, and it requires patriots with great passion, dedication, and eternal vigilance to preserve our freedoms. Jenny Beth Martin is the co-founder of Tea Party Patriots. She is an author, a filmmaker, and one of Time Magazine's most influential people in the world. But the title she is most proud of is mom to her boy-girl twins. She has been at the forefront, fighting to protect America's core principles for more than a decade. Welcome to the Jenny Beth Show.
Today, I'm joined by Dr. Kris Held, who is a doctor in San Antonio, and she is the co-chairman of Congressman Chip Roy's Healthcare Advisory Council. She is a board member of the American Association of Physicians and Surgeons and a past president of that association. And I think you're going to really enjoy this conversation. Kris, thanks so much for joining me today.
Thank you, Jenny Beth. I'm so happy to be here with you, and thank you for all you do.
Oh, well, it's my pleasure. And I love working with you and other freedom-oriented, doctor-patient-oriented doctors. Kris, why are you so active politically in the healthcare sphere in addition to treating patients?
Jenny Beth, that's such a good question. And I really became pulled into healthcare policy back in 2009, I think, when the Tea Party Patriots formed. Because it was just a shock. We grew up experiencing freedom, whether it be healthcare freedom, freedom of speech, freedom of expression. And suddenly that became in question. And so I think that just like you did and I did, I had to really sit down and evaluate what was going on with my profession. And I had been trained, I went into medicine to serve my patients, to take care of them with dignity, each individual patient. And suddenly there was a worldview emerging and we hit head on. There was a huge chasm of Hippocratic medicine on one side, where we do what's best for the individual patient, versus really what was, 2,500 years ago, the Plato's type medicine, where you did what was best for the good of society. And when we saw the Affordable Care Act being created, and the architects of that, like Ezekiel Emanuel, who is, known as Dr. Death. He specializes in death and dying. And he wrote that infamous article in the Atlantic, Why I Hope to Die at 75. And, you and your family should too, and created the complete life system of rationing, along with Don Berwick, one of his acting heads of CMS, who believed that we as doctors did too much for our patients, that government needed to step in. And in order to make things cost effective and have more social justice in medicine, that government needed to step in between the doctor and the patient. They wanted to treat this starting at medical school and try to have us treat groups, not individuals. And there were some very stark things there that, when you looked at what they were doing with life, for example, insurance companies, and this happened even as early as 1977, that would say, we're not going to give you chemo for your cancer, but you can have a drug to help you end your life. When they would have babies be born and let them sit on the floor until they died without providing them care. And, as we remember back in the day, Obama supported that. We had to ask ourselves, what does that say about where we are going? And so I made a choice at that time to look at healthcare policy, fight for Hippocratic medicine and healthcare freedom in the United States. And that is something I will never let go of. And I think that we saw a cascade of laws. We have devolved, and I read every word of the Affordable Care Act. In fact, when that was happening, I had a group of friends and patients. We tweeted every word of it, so that because people, it was passed in reconciliation so that we could find out what was in it after we passed it. And it was shocking. It gave the Secretary of Health and Human Services unprecedented power and money. And it really destroyed the patient-physician relationship. We all remember that convoluted chart with all of the Obamacare inner workings and regulatory capture and payoffs, and way down here, the patient, and way down here, the doctor. And what we want to do as part of Chip Roy's plan, and I'm so thankful to be a part of Texas 21 and have someone as brilliant as Chip and his staff. What we want to do is put the patient back in the center, holding the healthcare dollars, making their own decisions, because no one makes decisions better for ourselves and our family than we do. And, my good friend C.L. Gray, who wrote about the battle for America's soul with regard to healthcare freedom, reminds us that whoever pays holds the power to choose. And when insurance companies and big corporations are paying, they're choosing. And that's why in Texas right now, 1 out of every 5 claims are denied. They are denying patients rationing care. It's unethical.
That's unbelievable. 1 out of every 5 claims. Mm-hmm. That's like 20% of the treatment then is denied. And so then either the patient has to figure out how to pay for it on their own, or they don't get the care at all. Isn't that right?
That's absolutely right. And I think there are perverse business models that exist, Jenny Beth, such that they have an automatic denial. Say, for example, you need a certain drug that your doctor has prescribed, and a prescription is a medical order, not a request. They deny it first, and then you can try to do prior authorization and all these other hurdle jumping maneuvers. And if they deny it, they found that if they deny it a second time, 70% of people just give up. Either the doctor tries to get you samples, the doctor does it for free, the patient pays for it, or they just go without. And that's what really makes me sad, Jenny Beth, is that a lot of patients just go without.
Yeah, it's really quite disturbing. It's been over a decade ago, had to have 2 discs replaced in my neck. Mm-hmm. And the doctor wanted to do artificial disc instead of doing a fusion, because he said I was just too young to do something that was going to limit my mobility. The insurance company denied it at first. And I wound up pulling an attorney in to help write up why I should be approved, just because I needed to have the surgery. And I wanted to make sure that I could override what the insurance company was saying. But it's insane that I had to get an attorney involved so that I could get the surgery that the doctor said that I needed based on my medical history and my age. It's just, it's very frustrating because they just look at formulas at the insurance company. They're not actually looking at the patient at all. So who are they to decide exactly whether I need the treatment or not? And who are they to decide that your patients don't need the treatment when you've gone through medical school and actually are looking at the patient and their history and making a qualified professional decision? It's crazy.
It's absolutely crazy. And that just proves that coverage is not care. We were mandated to have coverage. Coverage is not care. Every promise was broken. When we were told under the Affordable Care Act that the cost would go down $2,500 a year, they absolutely have not. If you look between 23 and 2017, the premiums doubled. Right now in the United States, the average family pays $25,000 a year for health insurance. Most people are tied to the employer, which is really sad, because then when you leave your job, you can't take your insurance with you, which contributes to the pre-existing condition problem. It's really a convoluted system. And that's another topic of interest, how it devolved from that. But that what you went through denying your care is just wrong. And you're forced to pay the premiums. They're not forced to deliver. So they keep the money. And they also do things like say, well, Jenny Beth, you can have your surgery, but you have to do 2 weeks of physical therapy first. Well, my gosh, if you're in excruciating pain and can't move, how can you do physical therapy? Yeah. That's also 2 weeks. You're not able to work. You're not able to take care of your family. You're suffering. It is absolutely perverse. It is the equivalent of if our car insurance would, instead of saying, we'll pay for your car when you total it, nope, you can't get a new tire yet. Or nope, you can't fill with gas yet. You can't drive X amount of miles away from your home, but yet you have to pay a huge payment every month. It's unbelievable that we let that happen. And so when in 2015, and one of the reasons I absolutely love Association of American Physicians and Surgeons is they empower the patients and they empower physicians. It is a voice for the private physician, and our motto is all for the patient. And so in 2015, 10 years ago, I 100% opted out of all third-party agreement, every commercial insurance, and I went private contracted, opted out of Medicare. I found it morally untenable to work under the rules like you said. When I write a prescription, they deny it. When I say a patient needs this MRI, they say no. That is unacceptable. So now in a direct patient care model, and 5 years ago, I called it iSurgeon Direct. I have low costs. In fact, patients can come to me and get the same treatment outside of their insurance, less than it would cost to use their escalating deductibles and copays. And I'm able to immediately say, let's go do the surgery. Let's get you this medication. Let me get you right now and treat you. Let's get an MRI. Wow, we can get the MRI for $400, not the $2,500 that your insurance company has negotiated. There's a delta there. There's an amount that you bill and the amount that the insurance company allows. And that is vastly different. That money, what happens to that? It's kind of like what's happening with USAID. That money is laundered to layers upon layers upon layers of third-party data collectors, rationers, and all of that money does not go to patient care. It builds a corrupt system of regulatory capture and payoffs and revolving door. And boy, did we see the consequences of that government medical industrial complex with COVID. When we were denied care, mandated to have vaccine, forced to lock down, I couldn't even go to the OR. I had colleagues in Texas even that were threatened by the medical board for trying to take care of their patients.
It doesn't even make sense. It doesn't make sense. They're doctors who know how to take care of patients. There was a doctor in the middle of COVID. As you know, we were very active working with doctors, trying to, helping them sign letters and get the letters to the White House, to members of Congress about how to reopen and the need to reopen. One of the doctors who signed the letter, we went back and did a survey, and asked the doctors to fill out the survey to tell us other things that they were seeing, to try to figure out what they were seeing around the entire country, to have a better understanding of what was happening. There was one doctor in Indiana who told me he was an ER doctor, and a patient came in and had cut his hand on a canned food item. But because the hospitals were locked down and everyone was told, don't go to the hospital unless you have COVID or unless you're dying, he did not go in to get treated. And this is a routine treatment. It was a cut hand. He probably needed to have it cleaned out and stitches, something that would be fairly routine, but you can't do that at home. You need medical care to do it. But he did what he heard on the news. So he stayed home until it became so incredibly infected that he went to the hospital. The ER doctor saw him, had to admit him into the hospital. He actually had sepsis and died.
Oh.
He was only in his late 30s and left behind a wife and 2 children. So when the government and insurance companies make all these kind of decisions just based on the good of the whole, rather than looking at the individual patient and letting the doctor and the patient work together, there are so many unintended consequences that come from that it is just so completely wrong.
It is so wrong, Jenny Beth. And there's so many tragic stories like that. We had a complete and total public health nightmare and disaster. During that first period of time when we were shut down, and it was going to be the 2 weeks to flatten the curve and all that, which of course extended, we were not allowed to see anything but emergency patients. Well, who was deeming what was an emergency? I went into my office every day. I felt that as a physician, this was our call to the front lines. Right. We should be in the office. This is when we take care of our patients. It's not like we go to war and our frontline militia hides under the bed. Excuse me. So I was shocked. So I went in every day, and maybe I had a day where I'd see 2 patients, 3 patients. But I recall one day where a patient called and he said, Dr. Held, something's going on. I'm losing my vision. He was a little bit out of town. He said, my doctors won't see me. I don't know what to do. I said, get here. He got to my office and he was having a massive stroke. We got him to the hospital. He had a block, almost a complete total blockage in his carotid artery. He was able to have emergency surgery. We saved his vision. We saved his life. The next time I saw him a year later, he had gotten remarried. He was fine. But had he stayed at home like your patient did, he would have been dead or paralyzed and blind. And you can't be afraid. We have to be bold and courageous. Just like you fight for any sort of freedom, we have to fight for our healthcare freedom. And we need to remember that every day of our life. And I think one of the problems has been so many physicians now are employed because of that convoluted mess system. Payments are higher when you're employed by a hospital. You do the same surgery in a hospital or in your office or an ambulatory center. You're going to get paid way more in a hospital. So the hospitals go by practices. So now it used to be that physicians were all in private practice, very directly involved with their patients. Now the majority of physicians are employed by hospitals. If you're an employee, you can be fired. And when hospitals are being paid for certain diagnoses and rewarded for patients that are diagnosed with COVID, for example, or end up on a ventilator, when they get tremendous amounts more money, they're going to encourage that. And doctors that don't do that are subject to being fired. So this day and age, employed doctors have to do a certain amount of what they call conversions. Like for X amount of patients you see, so many have to have surgery. For in your clinic, doctors that are bought out by private equity, you better see a patient every 7 minutes or you're going to be penalized. So there's that side of it. And that's no quality of care. That's no relationship. That's pulling a protocol down. And the other side of that coin is going back in then to medical education. When we used to have the MCAT, we emphasized biology, chemistry, and physics. Now they've changed it to help you try to select people based on social and behavioral sciences. So it used to be that the majority of doctors believed in God, were pro-life, loved their patients. Now, I think like DEI and all sorts of things, there is ideology that they're able to choose who will matriculate in med school. And so I think that is another reason that things have changed. Also, costs have gone so up, people are in debt. And so as an employee, they're afraid to speak up because their livelihood is threatened. And I think one of the reasons that I was able to stand strong is that I was opted out of all the third party. I couldn't be kicked off an insurance panel or whatever because I was not employed by them. And it's all of that was created as a result of perverse healthcare policy because, again, where the money goes, that's where the power goes.
It's how it works with the healthcare system. It's how it works as we're seeing with USAID, and it's what happens in the entire government. And it just creates a very twisted system that takes the purpose and the initial good intentions of whatever the system may be and completely perverts them. Kris, I want to go back to something that you were talking about in the beginning, and that is, a lot of this, I think you and I both, I certainly learned a lot of it from C.L. Gray, and it sounds like you may have as well, but maybe you knew it already. We did a documentary back in 2000 and maybe 10 or maybe, no, I think it was 2012, about the government takeover of healthcare. And we did it based on a philosophy of healthcare that Dr. C.L. Gray describes. And the film is called The Determinators. It's available on YouTube if people want to go and watch it. The interesting thing about the documentary that we did is that we started out explaining this philosophy about medicine, not just the government being involved, but the entire philosophy of it. And you were talking about Plato and Hippocrates, and then you were talking about how Ezekiel Emanuel once wrote the article saying that he wants to die when he's 75 years old. And by the way, I just looked up his age, and I think he's about 67 or so years old right now. So he doesn't have a lot longer to live, according
His clock's ticking, 8 years. Yeah.
That's right. It would be interesting to see, like, in 10 or 12 years, if he's still alive, if he actually still thinks he should have gone ahead and died. But explain what does that mean when they're pushing more of a Plato approach to healthcare rather than the Hippocrates approach? I understood, but the audience may not.
Okay, so I want to say one thing about Ezekiel Emanuel's article. He's not saying he wants to die, but he just won't take any care because he doesn't want to consume any resources. So tying this into what you were saying, he authored the complete life system of rationing, where they take care from the very young, because, if you're 5, you're not as worthy of society because you haven't been. It's going to take too many resources to get you being 5, to 15, where you're big and strong. And you're not really worth a lot after 40. So what they do under his model is they take all of our resources and they target them to people between the ages of 15 to 40. And because they're looking at how does this benefit society, not how does it benefit individual patients. So the old, the sick, the disabled, the very young don't get care, as opposed to Hippocratic medicine, where your doctor is with you and will talk to you and do what is very best for you, decision-making that the two of you make. And it's a very godly Hippocratic approach. I remember C.L. Gray so well. I love him. And that was a great documentary movie that y'all made. That was awesome. He always would tell the story of Peter Singer, who was the ethicist, the professor. Was he at Yale? I can't remember exactly where he was, but he actually said, maybe we should not decide when life exists. Maybe what if it's not till a baby's 18 months old? When is societal worth being able to decide that that's worth a life? And there was such extreme ideology on that very far group, societal, serving the common good side, that it really shook you at your very core. And that's been going a long time. That's been a long game that they've played. And when we talk about the battle for America's soul, we need to bring it back to where we are. The American people are loving. We're compassionate. We help people. True charity is not compelled. If I want to take care of someone, I want to do it out of the calling within me, not because government's forcing me to or not, and forcing me to do things that are against my conscience or for the good of the government. We were really moving astray, and I feel very, very much better now that under this new administration, I'm hoping there's going to be some healthcare revolution and restoration of our core principles that we were founded on as a people. And I hope that RFK Jr. gets approved today. I think he will. I think maybe that's happening.
I think that that I got an alert right as we were starting to record that he did make it through the United States Senate. So we now have a new Secretary of Health and Human Services. How do you feel about that? Do you think he's going to be the right man for the job?
I think he's going to be the perfect man for the job because he's courageous. He understands the workings of the convoluted web of the government medical industrial complex as an attorney, as someone who is very knowledgeable about health matters, as someone who has seen the corruption and the graft and the grift firsthand. He is going to be able to untangle it. And, people who said, well, he's not a physician, look who we had under President Biden we had, Xavier Becerra. Before that, Alex Azar. They were not physicians, they were attorneys. And Becerra was the one who, if you look way back when he was trying to sue the nuns to make them cover abortion, when he was an attorney out in California, this is the type of person we have. I think under RFK Jr., we're going to have a person that wants the best for American patients, wants us to get healthy, wants to untangle the convoluted, perverse web. And remember when he said if he could do anything, he truly felt called. His life was changed from being wild, crazy, addicted to really having a new, refreshed start. And he said he felt called if he could even save one child's life. There you go. And so I think that is a dramatic change. And when we talk about this collision of worldviews, I'm just so thankful where we are now. I think we've been given a chance. I cannot imagine if we had continued down that road. One of the things with AAPS, several things that we've done, is we have taken bold stances. We have taken stances for example, early COVID treatment. When we published our early COVID treatment guide, we have taken a stance against the transgender mutilation of children under 18. We have taken a stance against vaccine mandates, against forced organ harvesting across the world. So we are able to be bold and courageous. And, we have sure taken our arrows and been demonized, just like everyone. That's what they do. They get on Wikipedia and they write the worst thing in the world about you. And now we know where all of this funding is coming from. It's been a propaganda war, communist Chinese party style. And we have just been the victims. And now I think we can stand up. And we're never done with our work, but I think there's vindication and think there's got to be justice. There can't just be words. There has to be transparency, accountability, and justice so that this doesn't happen again. And with what President Trump's done, coming in and saying no more gain of function and getting out of the World Health Organization, those are two huge pillars that needed to be set up from day one. I'm just so thankful.
Yeah, I think it is so incredible. And I'm very, very thankful. I'm thankful that the American people followed President Trump's lead and that he is president again. And the cabinet that he is appointing, they're doing amazing. The ones who've already been confirmed are already doing amazing work. And the ones who are still moving through that process, I know we're going to see amazing results from them very, very quickly. One of the things that I'm looking forward to the most about Robert Kennedy Jr. is that I don't know him well. I have met him. I'm sure he wouldn't know me from Adam, but I got to know him a little bit during the COVID situation. And then I know a lot of doctors like you who are in much closer contact and are working with him. And one of the most fascinating things to me is that he really wants to understand the data and understand how the departments and the agency itself is making the decisions. And is the data truly sound data, or are there biases in it, or are there things that maybe are not being made public that goes kind of to your transparency point, that the public really should know when they're going about making decisions for their health care. And I think that's tremendously important, even when it comes to, say, vaccines. It may be that when you look at the data, we see that there is a greater risk for a certain population. I have no idea. I'm just throwing that out, and I'm certainly not a doctor. But some people may think that risk is still worth the benefit of being vaccinated, and others may not want to take on that risk. I think that kind of decision should be made between the individual patient and their doctor, who's looking at them, can see where they are physically, like looking at their body to make those kind of decisions, whether it's about vaccines or surgeries or anything else health related. And then making the right decision for them individually, rather than this whole of society approach that began, as we've been talking about, with Obama, and just really came to light. Like our worst nightmares came true when COVID got here. And it wasn't that our worst nightmares came true because of horror stories about pandemics. The worst nightmares came true because we saw total government control.
We did. We saw authoritarianism, totalitarianism, and we acquiesced shockingly in a very cowardly fashion. Because at that point in time, I think we trusted our government more than we do now. They have shattered the trust. The agencies that I'm hoping that RFK will go in and just completely get to the very core of it, are particularly like the CDC and the FDA, and he will. The CDC has had willful blindness. We have excess death. We have all sorts of things that they have not looked at. And our perverse system has, people are going to code. There was a law, remember MACRA, the Medicare Access and Chip Reauthorization Act, with MIPS, merit-based incentive payment system. So government payment models are adopted by the commercial payers, and they pay physicians and practices on a score. There was a thing called the physician composite score. And if you did what government said, for example, in their 4 categories of cost, quality, electronic health records, and practice improvement, you would get paid Medicare plus 20%. If you didn't, you'd get paid Medicare minus 20%. So you had doctors doing the same thing, being paid a 40% differential. I'm rounding off here. Now let's look at what you got paid for. You were a good doctor if you got 10 points for cost. You were a good doctor if you paid 0, if you spent nothing on your patients. If you were a doctor that actually wanted to work patients up, get the labs, get an MRI, you got 0 points. So I wrote a piece one time, I called it the Scarlet Zero. So the doctors that got in there, spent time with their patients, took care of them, quality. They'd say all the blood sugars have to be less than 100. Well, if you do that, you've got a certain percent of patients that are fainting and passing out because their sugar too low. We're not robots. We're all different. So if you didn't do exactly what the government said on all of those protocols, you got a poor score, you were a bad doctor. And that is meaningless, yet that's what people are going to strive to achieve because they want to get paid. And same thing with the hospitals. If they would code a certain way, the ICD-10, the International Classification and Diagnostics, the coding ICD-10, that was another thing that I said, I'm out of here in 2015 because you're coding and filling in blanks so that you can get paid. And so what happens is suddenly the codes have become more important than reality. What's really going on with the patients? Because people are going to code to the highest level to get paid the most. And I know of times, we used to round and go see our patients. I know now sometimes interns in the hospital are relegated to coding and entering things in the computer. They're not at the bedside. And they have nurses and specialists rounding with them in the hospital to tell them how to code to the highest level to get the most money, rather than spending time talking about the patients. So that's a very, very perverse model. And I hope that those sorts of things will be dismantled, because the data that we collect from that doesn't tell you anything about reality. It tells you how to get the most money for the person coding. So that is a big farce. And there's willful blindness on the part of the CDC and the FDA with drugs they're coming out with. If you look at how they've hidden vaccine adverse events and this sort of thing, that needs to all come out. And they need to look at every state. You can take, for example, the vaccine records and the death records and correlate them. How about remdesivir, people that were put in the hospital? That data is waiting there to be looked at. We should know the outcome of every single patient that got remdesivir in the hospital, because that data exists because the government paid for that drug. We should know that now. That we don't is criminal. It's withholding very important information. Maybe we'll find out it was great, but maybe we'll find out it won't, and we shouldn't have been mandated. So I cannot wait for him to get in there and get data that is meaningful, that will help us be better. And one of the things I love about Chip, one of the things we have in common is that in the I think 2012, 2013, I don't know exactly when he was, but we were both diagnosed with cancer and went through treatment. Obviously, we're both here. We survived. We were very thankful and beholden to our doctors and nurses and our care that we received. But we also saw it from every side. And we see what's happening with that. And I am so thankful that he has taken on healthcare freedom and tying us back to reconciliation, take us back to when they brought the Affordable Care Act in through reconciliation. We've got reconciliation going on now. And we have a very slim margin in the House, a very slim margin in the Senate. We are not going to get 60 votes on anything, but we could sure try to get some very important things in through reconciliation. We have a few months to do this, and it has to be done quickly. And he has his Healthcare Freedom Act. He has his Personalized Care Act. And these are amazing, very simple, and the Direct Patient Care Act, 1 and 2 page pieces that can allow us an exit ramp out of this system to choose to let patients control their medical dollars and decisions. And we're not saying, if you like your Obamacare, keep your Obamacare. If you like your Medicare, keep your Medicare. If you like your Medicaid, keep your Medicare. If you like the VA, but if you want something else, there's an option. We've got to allow that to happen for the American people.
Yeah, I think it is so incredibly important. And I think that if we are saying that if you like it, you can keep it, it actually is something we intend to help people do, unlike the lies we were told in 2009 and 2010 to get Obamacare passed. When it comes to the different acts that Chip Roy has, the different bills that he's trying to get passed, do you know what is in the Healthcare Freedom Act? And if you don't, it's okay, but you mentioned it, and I'm just wondering if you know what's in it. Okay.
I do. We've been working on this. It was introduced in the last Congress. We've been working on it for a long time. It's actually right now has a number, HR 317. What it does, so right now we spend in the United States of America $4.9 trillion a year on healthcare, and our life expectancy has gone down. Our access to care has gone down. Our premiums have gone up. Our deductibles have gone up. It's been a nightmare. And we mentioned $25,000 a year is what families are paying on healthcare to go through what we've mentioned. And the current amount that you can contribute to a health savings account is like $4,000 an individual and $8,000 a family. What this does is it takes it up to, if it's going to cost your family $24,000 a year to have health coverage, this increases the ability to put in $24,000 a year into a health freedom account or a health savings account for a family, or $12,000 an individual. Now, if you could do that and get the triple tax advantage like those in employer-sponsored insurance plans do, which is 180 million people in the United States get it through employer-sponsored care. If you could afford the individual American, the small mom and pop, small business owner, individuals, that same tax advantage ability to put money in a health savings account, right there, we can really solve most of the problem. So you can take this money, you can put it into the health savings account, and you can use it for your premiums, for your direct patient care, for your medications. You can use it for everything. And if you're healthy that year, the next year, think about how much more you have. Then you could invest that. Your health savings account could grow. And imagine if these accounts started when you were a baby. You'd have it your entire life. You would never have the problem with portability of losing your insurance when you change jobs. You would totally eliminate the pre-existing conditions, because the only thing your pre-existing condition is you were born. So you could make these choices, and then there would have to be competition, because if you have your money, you're not going to go get the Affordable Care Act plan that is tremendously expensive. You're going to get another plan. Maybe you'll get a health sharing ministry. Maybe you'll do a high deductible plan. All of a sudden now the insurance companies will have to just provide insurance, not rationing, gatekeeping, and coverage. So we'll get a robust offering of plans that we could take in conjunction with our health savings account. Costs will come down. Access will go up because patients will pick doctors that will communicate with them, spend more time with them, know them. It's just the beginning of a wonderful revolution, putting us back in the center. And there will have to be, there's going to be competition for meds, because if you can go get a generic med, why would you go pay the expensive one that, United Healthcare makes you get at CVS or whatever it is? So I think that is extremely important, that is tax advantage. There's portability. Now, the Democrats will complain and say false things like, and it's not just the Democrats, both parties are corrupt in this, but the only way we have to get this through is to go with Republicans in reconciliation and pray maybe some Democrats come over, but usually they stick together. But they're going to say, well, only the rich can put into a health savings account. And did you know that's not true? About 70% of us put into it, but most people that put into a health savings account, the majority earn under $110,000 a year. And did you know the Obamacare subsidies, how expensive they are? You can get an Obamacare subsidy with a family making up to $600,000. Now that's insane. Medicare, 66 million of us on Medicare. It's about to be bankrupt with all the baby boomers going on. And you can't, once you get Medicare, you can't put money in a health savings account. Congressman Roy's plan, everyone from veterans to seniors, everyone can continue to put money into a health savings account for their entire life. And wouldn't it be nice if they could be passed on generationally? Or as beloved citizens of our community, we could donate if we have people that are born into poverty. There's so much we could do here. Put into people's individual health savings account, empower the individual, empower the patient. So it's a beginning. It's very simple. And I'm really hoping that we'll get some of this maybe into the reconciliation bill, just something, even if we can just expand that. I would say if we can expand contributions and make them for every American. No more discrimination.
Yeah, I think that's exactly how it should be. And you're right. They will say things about the access to care, which you and I both understand doesn't mean care. It means the access to coverage for people who are more poor. When I started fighting Obamacare, I had just come out of bankruptcy, and my then husband and I had gone through, we went through financial crisis, and not basically, we went through financial crisis. And one of the things during that time, we had to have some sort of surgery. He had to have a surgery, and we had to work out a payment plan with the doctor. The doctor told us that because the doctor took, I don't remember if it was Medicaid or Medicare, but he accepted some program from the government, that he could not donate the services to us. Otherwise, he would have donated the services. So he gave as much of a cash discount as he was allowed to give, and we paid it off over time. But I found that to be one of the most bizarre things in the world, that because the government is getting involved, doctors who actually want to be able to donate their services to help families in need are prohibited from doing so. And it's another one of those perverse incentives that happen when the government gets involved. And then another thing that we noticed during that time, we were able to work things out with our doctors. So when we were saying that we were opposed to Obamacare and the government takeover of healthcare, reporters would say, well, what about the poor people? And I would say, I'd go through what I had just been through in the last 12 and 18 months. And I knew more about the healthcare system and what a person who isn't making as much money would experience than the reporter did. He was just kind of giving out talking points and questions that they, I guess, had memorized, and they thought they were the ones they needed to say. But another thing that I found really interesting is that there are grocery store chains, and eventually like Walmart and I guess Target, I'm not sure about Target, started following suit that would offer certain generic drugs at such a deep discounted price that if you really could not afford care, you basically could either get your prescription, depending on what it was, for $4 or $8 a month. It wasn't even very much money, but the The point is, America's an extremely generous country. We are an extremely generous people. And when we see people in need, we don't have to be coerced by the government with the threat of the IRS taking something out of our check or jail time to be good to other people. We just genuinely step up and help take care of people. And I experienced that when I was going through my financial crisis. I'm sure that you as a doctor, I mean, you already talked about how there was a man who was having trouble and you told him to come down and he was in the middle of a stroke and you helped save his life. It seems like that happened, and the government doesn't even have to be involved at all. We just do that naturally as Americans.
You know, Jenny Beth, I had to opt out of all commercial insurance and Medicare because of such a perverse policy. If I had stayed as a participating provider in Medicare, if I were to see a patient on a Medicare HMO that was not in my group, or if someone had no money, I would be committing fraud if I saw that patient for free. Also, with a Medicaid patient, if I don't take Medicaid and I see the patient for free, when I write a prescription, they won't honor it. Now, with Medicare, they will. But those are two policies that should be fixed right now. So because I'm not in any insurance, a patient, if your deductible is $5,000 and you don't have it, I can do your surgery for $1,000. If I'm in with that, if I have an agreement with that insurance company, I have to charge the $5,000. Okay. So by opting out, I am able to offer direct care to the patient at less cost without facing federal penitentiary and fines for committing fraud. It's absolutely incredible. So I can deliver true charity care, which I love. People also have dignity, Jenny Beth. And if they can pay $45 for a visit, they're so proud to do that.
Right.
And so people say, well, you can only do that because your office is in some fancy part of town. That is not true. I may have the most famous person in Texas as a patient sitting next door to a patient that walks to work or has no money or is 90 years old and can't get there. And I can care for those patients in exactly the same fashion with the exact same type of care. And in fact, I just created the Century Club. I have so many patients over 100 now. I don't charge them. They're on Medicare. I charge them $0. I was going to move it down to 90, but so many people are living to be 90. I'm putting it around 95. But this other thing about medications, you know, many states have in-office dispense. So physicians, and I think Josh Bear with Atlas MD does such an exquisite job of explaining this and doing this. You come into your doctor, and if you need Lipitor, you know, you can get your whole months of drugs as part of your DPC fee, your direct patient care fee. I could keep drops in my office, like for glaucoma, $5 a month. You come in, you see me, you leave, you pay your $5, you're out of there. Now, Texas, of all states, does not have in-office dispense. We cannot do that. So Michael Garrett, in 2019, this is another thing that happened. With Institute for Justice, we filed a suit against the state to allow Texas physicians to have in-office dispense. Well, COVID came and it got delayed and everything. I'll tell you, I'll cut to the chase. It got appealed all the way up to the Texas Supreme Court and we lost. But had we had in-office dispense during COVID, the patients could have come to our office. We could have given the meds and they could have gone home. To me, I was like, oh, this is the perfect time they're going to prove it. Absolutely not. Instead, what did government do? Oh, no, pharmacists need to start turning down physicians' prescriptions. You know, it's a convoluted mess. So the only way in Texas we're going to get anything like that through again is every 2 years, bring it through the legislature. And every 2 years we do. And every 2 years, Big Pharma beats us down. You know, but for the states that have that, like you said, utilize direct patient care. Utilize in-office dispense of your drugs. Just give us this off-ramp and let us use our direct patient care dollars tax-free. You know who's not insured right now, Jenny Beth? The working American between 55 and 65. Because if you're self-employed, you and your husband, how can you afford the first $25,000 of your earnings to go to insurance premiums, not care? At least under this plan, that $25,000 would go into your health savings account. We've got to get this in.
Yeah, it is such an important thing to get past. So, Kris, as we're wrapping up, as people are listening to this, what can they do to be involved to help the work that you are doing with Chip Roy, with Congressman Chip Roy? And also, I'm sure you're going to be doing things that help the Trump administration and Robert Kennedy Jr. as Health and Human Services Secretary, which he's approved now. It's very exciting.
Wonderful.
What can people do to help out and be active?
Okay, so important. People need to know, and you preach this all the time, who our representatives are. I mean, it's easy. We only have 2 senators and we have 1 U.S. representative. So at the federal level, you need to contact your representative and say, what are you doing about healthcare freedom? They need to sign on to these bills. If they are a Republican, or I don't care what they are, they need to get that through reconciliation, and we need to call them and write them. They don't even know what it is. I think there are representatives in there that don't know the difference between Medicare and Medicaid or Obamacare. And by the way, Obamacare just put everybody on Medicaid, but they've got to contact them and get them to get going on this. And then as far as, for example, RFK Jr., if you have had real life experiences, and we've seen this with our eyes. I have my own brother-in-law who's a physician who had a huge blood clot after the COVID vaccine. These things, make sure they're reported. Report what you've seen, report what you've lived. Don't let them hide it. Let's pursue truth at the agency level and then at the state level. Get your attorneys generals and get your governors and get your representatives to get things like in-office dispense. Fight these battles, educate them, because we have to be educated ourselves. So then there are groups like AAPS, Association of American Physicians, that patients can join and you don't even have to pay a dues or anything. Join as a patient or non-physician member, and you have access to where are the direct patient clinics and doctors across the country? What are the Medicare laws? What can we do? So you have to do advocacy at the community level, the state level, the federal level, and then at an organizational level, and talk to your doctors. I think that's so important. Talk to your doctors face to face about what they're doing and what you're doing. And that's where it starts.
Very good. And I think that last point of talking to your doctors is sometimes overlooked. But if you can have that kind of conversation with your doctor, you can help them begin to become active as well. And we need more doctors who care about the doctor-patient relationship, speaking up and taking action. Mm-hmm. Well, Kris, thank you so much for joining me today. I hope that everyone learned a lot. They can go check out the Determinators and check out the American Association of Physician and Surgeons website, AAPS. And then where can they follow you online for more information?
So I think it's super easy just to go on X. A lot of people do that. It's Kris Held MD, but it's at KKS Held. But if you just put Kris Held MD, hopefully you get there. And I love to interact with people and share things and talk. And it's just so important. Everything from just praying for one another when we're sick or injured or what to do, to sharing stories that have happened. And it's just important to connect as a people.
Very good. Well, thank you so much for joining me today. And thanks for everything you are doing to help stand for healthcare freedom.
Thanks, Jenny Beth. Thanks for all you do.
The Jenny Beth Show is hosted by Jenny Beth Martin, produced by Kevin Mooneyhan, and directed by Luke Livingston. The Jenny Beth Show is a production of Tea Party Patriots Action. For more information, visit teapartypatriots.org.
If you like this episode, let me know by hitting the like button or leaving a comment or a 5-star review. And if you want to be the first to know every time we drop a new episode, be sure to subscribe and turn on notifications for whichever platform you're listening on. If you do these simple things, it will help the podcast grow, and I'd really appreciate it. Thank you so much.